everyone and welcome back to my YouTube channel. So today's topic is about the important books for semester 7 according to the PCI syllabus in B Pharmacy. So the first subject that we have is instrumental method of analysis. So in instrumental method of analysis, you will have to refer multiple books because the content in each book isn't suffice. So from every book you need to have some or the other content. Like Supriya Majan, spectroscopy and chromatography. It's given in a very concise manner. So you can refer for spectroscopy and chromatography Supriya Majan. While there are some additional contents in BK Sharma and YR Sharma. So you can refer those books as well. That would be helpful. In Chatwal, fluorimetry and flame photometry. That is given in a very proper way. So you can refer those topics and even nepheloturbidometry. So for that you can refer Chatwal. In Ashutosh Kar you can find electrophoresis and HPLC. Electrophoresis, especially capillary electrophoresis, that is present in Ashutosh Kar. Other books that you can just refer for your reference is Kenneth and Connors and PD Sethi. The next subject that we have is industrial pharmacy. So industrial pharmacy basically consists of all the important websites. So it's better not to refer any books. Like there are certain books available, yes, agreed, for PCI, but it's better that you get information that is latest from the websites itself, because it gets updated, it gets revised in a particular span of time. Like you have about ICH guidelines, so it will be better if you refer the ICH guidelines. Then you have about GLP, so the CPC SEA guidelines and the good laboratory practices. Then you have about ISO, International Organization for Standardization. In ISO you have to refer both 9000 and 14000. 9000 is for quality and 14000 is for environment. So you have to refer the official website of ICH, GLP, ISO and other regulatory bodies like CDSCO, Central Drug Standard Control Organization. So this is our main regulatory body of India, under which there is a DCGI appointed, who is responsible for marketing and commercialization and approval of drugs. So when it passes the clinical trials, it needs the approval of a DCGI. So these are all websites. CDSCO, you just have to type CDSCO and the website will be available. And there you, in the About Us section, you can get information. Also in some websites there will be a PDF available of the same. There will be a detailed explanation of the available in a PDF. So you can just refer the PDF as well, not a problem. Then you have WHO guidelines for technology transfer, WHO for TT, for technology transfer. So what is technology transfer? Is basically transfer of technology from a sending unit to a receiving unit. So who has given, that is World Health Organization, they have given certain guidelines for this technology transfer. So refer those guidelines according to the WHO only. In the books there might be manipulated language, but in the exam you have to write proper legal language that's mentioned in the documentation. Then you have certain terms and you have to refer those websites that I'll be writing name. First is NRDC, next is BCIL, next is SIDBI. You just have to type these names. Next is TIPSI, TIFAC and APCTT. So what are all these? These are basically your important guidelines that you have to refer, and these are technology transfer agencies. So they have certain functions, like some will provide funds, some will provide a collaboration, some provide confidence, and they help in patent restoration. So there are multiple companies that are useful for startups, for entrepreneurs, for corporates, that provide syndication of funds, that provide you an amalgamation with an international workers, international companies also. So first we have NRDC, that is National Research Development Corporation. So this is a very important site. So these are agencies that are under the, that is basically having many themes like agrochemicals, transports, water preservation, sustainable development, harvesting, etc. So there are multiple fields under this NRDC. Next you have BCIL, that's specific for biotechnological products. More biotechnological products like rDNA, monoclonal antibodies, etc. BCIS stands for Biotech Consortium India Limited. Biotech Consortium India Limited. TBSC, Technology Bureau for Small Enterprises. That is for MSME. Now, what is this MSME? Micro, small, and medium enterprises. So there are certain enterprises that are available in different scales, whether it be micro scale, small scale, medium scale. So Tipsy provides these funds and collaborations for all the scales. It is basically a joint initiative of APCTT and SIDBI. These two agencies have found out this individual agencies, you can say, or they have aided in formation. SIDBI and APCTT. Just remember, this might be asked in the MCQs. APCTT stands for Asian Pacific Center for Technology Transfer. So Asian Pacific Center is also has the same work, but it majorly works for women entrepreneurs. So it help if there is any woman who has found, who has some good ideas, who some good startups or some good research work, so that can be given a boost via this APCTT agency. SIDBI is standing for Small Industrial Development Bank of India. Small Industrial Development Bank of India. So this isn't that much of popular as compared to others, but yes, SIDBI is also very important agency. And the last you have TIFAC, Technology Information Forecasting Assessment Council. So TIFAC is also a technology transfer agency itself. So you can refer that. Next, you have to refer the SUPAC guidelines. That is also a website, that is scale up and post approval changes. But it's given in book in a pretty nice language, so you can refer books like Douglas. And there are some PV books also by Dr. Samir Malaviya. There are different publications like Thakur, Nirali Prakashan. You can refer their books for this particular chapter. It is suffice. And for other topics like there are quality management system, TQM, QMS, risk management system and all that. You can refer two books, that is Poddar and Ashok Hazare. You will find the quality management system and other related topics to quality in a very, even qualification in a very broad detailed way, because they have given examples of all the four types of qualification, that is BQ, IQ, OQ and PQ, and they have explained it in a very concise way. Like for example, I'll let you know design qualification. So you're ordering an equipment. How much is the dimension of your equipment? What is the length? What is the height? Should it contain metal detectors? Is it vacuum? Is it in vacuum utility? Does it have a heat supply, or does it have a fire resistant chamber? Then is installation. Once you have ordered, you have received as per the design, then you install it in your premises. Is it getting installed well? Are the utilities like water supply, heat supply and all properly working in conjunction with each other? Next you perform is the operational qualification. Now you have installed your device, your equipment. Is it operating well? Is it properly showing revolutions? Is it showing mixing, blending, compression, whatever its uses? Next is performance qualification. Once it's operating well, you have to see that it is working at the predetermined rates also, and at the extremes also, at the bracketed values and ranges also. So design is something that design qualification is something that you perform in a pre-installation way, in a pre-installation stage. Installation qualification and operational qualification you perform during installation stage. Performance qualification you perform post installation phase. So this concept is explained in a very beautiful way in these books, so you can refer. Even validation, the different types of validation, retrospective, prospective, concurrent validation, those are also explained in a very proper and appropriate manner. Next, you have to importantly study about OOS, out of specification results. So that is also, you can refer the books for that topic. Certain important terms like CTD, ECTD, CTD, ECTD, these are under multidisciplinary guidelines. M4 according to the ICH, M4 and M8. In CTD is M4 and ECTD is M8. So these are under ICH guidelines. So that is important that you study these guidelines from ICH itself and not any other side. So that's all for this industrial pharmacy. Next up, we have pharmacy practice. In pharmacy practice, basically we have different subjects. So for like clinical pharmacy, hospital pharmacy, community pharmacy. So there are particular books for that particular topic. Like for clinical and hospital, both there's a common book, that's Tipnis and Bajaj. There are two books actually, Tipnis and Bajaj for hospital pharmacy, Tipnis and Bajaj for clinical pharmacy. So you have to refer two books for the same. Especially in clinical pharmacy, you have ADR, reporting, and the types of ADR. There's another book that I'll write over here. I have not mentioned it. Pratna Sarthi. That's a very good book for ADR. I forgot to mention that. Pratna Sarthi. So in this you have about TDM also, that is therapeutic drug monitoring. You have you have many related topics of your interest of clinical pharmacy, and community pharmacy is also even in this book, like the communication skills of a pharmacy, the drug distribute medication adherence is also mentioned in this topic. So many of your syllabus ka topics are being covered. In Tipnis and Bajaj book, you have all information about the types of hospital, the organization of hospital, the formulary of hospital. Then you have all drug distribution system. So that is all given properly in the Tipnis and Bajaj. You also have books that are, of course, you must refer them. I highly recommend the book by William Hassan and a book by Merchant. Especially William Hassan has a very proper manner of all the hospital pharmacy related stuff. Like they have also given images, so that will be beneficial. Like suppose if a ADR reporting form, if it's a formulary, drug list, they have given proper form for that, proper image for that. Next we have is the NDDS, that is the novel drug delivery system. For microencapsulation, you can refer this book. That's the best topic given in the Malakman and Lieberman, microencapsulation. Also for your industrial pharmacy, the pilot plant that's given, that also you can study from here, because pilot plant is also given in Lackman and Lieberman for industrial pharmacy. NK Jain, there are liposomes is given in a very proper manner. Even there's one more book that I have not mentioned here, but I strongly recommend that book for controlled release. That's Robinson. You have to refer this book for controlled release. For controlled release. Like all the sustained, modified, delayed, prolonged, extended. Next you have book by NK Jain and SP Vyas. SP Vyas is again for controlled drug delivery system, very properly given in this book. You would also find out many similar topics in this book, like the mucosal drug delivery system, the mucoadhesive system, nasopulmonary system. In Marshall and Decker, again you have implantable, very nicely given, implantable drug delivery system. Besides implantable, TDDS, that's transdermal drug delivery system, that is also given. That's a part of your topic in a proper way. And for intrauterine devices, for ocular drug delivery system. That's ocucerts, lacicerts, contact lenses. And for nanotechnology, that's nanoparticles, monoclonal antibodies. You can refer different articles also, and in books also it's given, but especially Shane, in the book of Shane, it's given properly. So you can refer, of course, Shane book. But I would suggest that you look out for articles because it's given in a very, very definite manner. So it will be better that you refer some articles only for this book, for this topic. So that's all for today's video. I hope you got to know which book to study for which topic and which subject, and what books to refer, how to refer, and correlate the concepts. So if you have any comments or any doubts, please feel free to put your doubts in the comment section. Thank you so much everybody for watching the video.